because if a hospital improves their process, that's a good thing for all of us because we're all impacted by that improvement in the process. If and when this passes the House, buckle up. If you thought healthcare was expensive and low quality before, you ain't seen nothing yet. The One Big Beautiful Act just passed the Senate.
She says a lot on that. And, I'm going to talk to you, Aisha, about this. First, I want to read a comment. Anonymous person says, I feel betrayed because the One Big Beautiful bill does not have reparations in it. Trump could have put reparations in that bill, man. Dude, not today. You know darn well this man did not give a shit about any of us. Reparations or no reparations. You keep hollering about reparations, but they are never going to give us our reparations on the 40 acres and a mule. You know that. We're not going to even debate that. So please don't start with that mess. You need to put facts in your feelings in. But you and I both know reparations will never be seen in our lifetime, if ever. Now, Aisha, she is talking about a tax on public health and social services. You are our financial expert, and a lot of the times, we don't have these things. We don't have the insurance. We don't have these type of services. So I'd like to hear your thoughts on what she said about the public health and the social services that she discussed. How is this going to impact our community?
Yeah, it's amazing when she was laying down all the different aspects that will be affected. And you would think, I say, wow, she's right. Because if the funding is cut to all those, services, then you have less people there to do the work. And then the workload will increase. And of course, who gets left behind? Our people. Because when you go to the hospital, they will not look at you if you have a certain color, you're less been active taken care of. So that will affect us in that way for sure. And I know it's very sad to me. Unfortunately, this affects all of us, even though we're not thinking about it. It will affect every person, but some of us more than others. And then what do we do about this? Being in the financial industry myself and just thinking about, now that I know more about how to prepare and how to plan, at the end of the day, there is something in us that has to help us understand that we can't rely on other people to provide some things for us, especially in America. It's just, you only keep hitting your head against the wall over and over again. In other countries, it's almost like a slap in the face if you go to a doctor and there's no doctor for you, because it's unheard of. But here is part of the money making machine. It's a capitalist country. So everything is capital. How much money? And then if you don't have the money, you get the worst treatment, right? Which is horrible. When other countries, it doesn't matter. Medical care you need, you get it. But again, we'll always bring that part in that say, well, if you don't have the money, you get less care. That's true. But there's something about if all of us are in the same boat. But in America, it's different. Some people get better treatment because of the way they look. So those of us that don't have that look, and then we have less people now helping, guess what? We'll be left behind in the corridor, probably to die, or no care, or nobody will check on us. That's the part that to me is tragic when it comes to this bill and the healthcare portion.